Have you ever wondered what happens when the doctor's office closes for the night? Imagine the sun is set, the office lights are dimmed, and the regular staff is home. Yet the world of healthcare doesn't stop. This is where on-call care comes into play, a critical component of the healthcare system that often remains unexplored. On-call care is like the night watch of the medical world. It's the healthcare professionals who are ready to respond, diagnose, and treat patients outside of regular office hours. And it's not just about being available. The complexities of on-call care are numerous and pose unique challenges for both medical professionals and patients. For medical professionals, on-call care can be a test of their adaptability and quick decision-making skills. They must navigate through a sea of patient concerns, from minor issues to severe health crises, without the luxury of a well-equipped office or a team of colleagues to consult. It's a high-stakes world, where every call could be pivotal to a patient's health. On the other side, patients are often anxious, uncertain, and in need of immediate care. They rely heavily on these unseen heroes who, despite the distance and time, are there to provide them with medical assistance. Yet, the frequency of on-call problems is surprisingly high, and the potential consequences can be severe if these issues are not effectively addressed. We're talking about missed diagnoses, delayed treatment, and in some cases, irreversible health damage. And the reasons are varied. It could be due to miscommunication, inadequate information, or the sheer complexity of making critical health decisions over a call. For the patients, these on-call issues can be a matter of life and death. The stakes are high, and the room for error is small. But how does it look from the trenches? What happens when a seemingly ordinary call turns into a complex medical dilemma? Let's explore some real-life cases to better understand. After all, understanding is the first step towards improvement. And in the world of on-call care, improvement can mean the difference between life and death. Consider the story of Jane, a 40-year-old woman who experienced severe abdominal pain in the middle of the night. Jane is a diligent worker, a loving mother, and an active athlete. She's no stranger to pushing her body to its limits, but this pain was unlike anything she had ever felt before. It was an agonizing, sharp pain that seemed to radiate from the pit of her stomach. It was not just a simple stomach ache. It was a distress signal that something was terribly wrong. In the wee hours of the night, Jane dialed the on-call number provided by her healthcare provider. The voice on the other end was calm and collected, a beacon of hope in Jane's moment of pain and fear. The on-call nurse asked Jane about her symptoms and history, advised her to take an over-the-counter pain reliever, and encouraged her to rest. While the advice was standard protocol for a range of abdominal pains, it failed to take into account the severity of Jane's pain. It was a one-size-fits-all solution for a problem that was far from generic. Jane followed the advice, hoping for the best, but the pain persisted, growing even more excruciating. Hours later, Jane's husband rushed her to the emergency room. A series of tests revealed that Jane had acute appendicitis. Her appendix had ruptured, and she was in a critical condition. She was immediately taken into surgery. The delayed response had escalated her condition, turning a manageable situation into a life-threatening one. This is not just a story about Jane's physical suffering. It's also a tale about the psychological toll it took on her. The fear, the uncertainty, and the feeling of not being heard or understood. It's about the trust she placed in the on-call system and how it failed her when she needed it the most. Jane's ordeal is a stark reminder of the importance of effective on-call care. It underscores the need for healthcare providers to fully understand the patient's condition before giving advice. It's about listening to patients, asking the right questions, and not rushing to conclusions based on generic symptoms. It's about recognizing when a situation calls for immediate intervention, instead of adopting a wait-and-see approach. This story is not an isolated incident. There are countless Janes out there who have faced similar situations. This is a call to action for healthcare providers to reassess their on-call protocols, to ensure that they are equipped to handle such emergencies, and to remember that each call is a person, a life, that depends on their judgment. Jane's case illustrates the dire consequences when on-call issues are not effectively managed. Let's strive for a healthcare system that is responsive, empathetic, and efficient, one that ensures that no patient feels unheard or neglected. After all, isn't that the very essence of healthcare? Now, let's turn our attention to John, a 50-year-old man who felt sudden chest pain while at home alone. John, a seemingly healthy middle-aged man, was sitting comfortably in his home when he felt an unexpected, sharp pain in his chest. Out of concern, he quickly dialed his healthcare provider's on-call service. The on-call nurse, trying to assess the situation over the phone, brushed off John's symptoms as merely heartburn, advising him to take an antacid and rest. John, trusting the professional advice, took the recommended steps. But the pain persisted. Hours rolled on with no improvement. The discomfort in his chest grew from a nagging pain to an unbearable ache. The initial advice he was given, unfortunately, did not address the severity of his condition. The next morning, John's discomfort had escalated to a point where he could no longer ignore it. He dialed 911 and was rushed to the hospital. After a series of tests, the doctors confirmed that John had suffered a heart attack. The heartburn diagnosis over the phone was a misdiagnosis, a critical one at that. This delay in getting John the necessary medical attention had serious consequences on his health. The prolonged lack of treatment led to significant damage to his heart muscle. It was a close call, a situation that could have been avoided if his chest pain had been accurately assessed in the initial on-call interaction. John's case is not an isolated incident. It's an example of the significant challenges that come with on-call care. While the convenience of on-call services is undeniable, there are inherent limitations. The absence of physical examination, the inability to conduct immediate diagnostic tests, and the reliance on patient-reported symptoms can sometimes lead to misdiagnosis. Healthcare providers must remember that chest pain can be a symptom of various conditions. While it may often be heartburn or acid reflux, it can also be a sign of more serious conditions like heart disease or even a heart attack. The challenge for on-call professionals is to make the best possible evaluation based on the information given, knowing the stakes can be high. John's situation also highlights the importance of patients advocating for their health. If the prescribed advice doesn't alleviate the symptoms, or if the pain intensifies, patients should not hesitate to seek immediate medical attention. In John's case, his decision to call 911 undoubtedly saved his life. The complexities of on-call care are vast, and the margin for error can be life-threatening. It's a crucial part of our healthcare system that needs continuous improvement and refinement. It requires a delicate balance of rapid response, accurate diagnosis, and effective communication. John's case underscores the critical need for accurate and efficient on-call care. In the end, the goal remains the same: to provide immediate, effective care that prioritizes patient safety. And in that endeavor, every second counts. As we've seen with Jane and John, on-call problems can have profound effects on patients. Let's delve deeper into this issue. Misdiagnosis is a key concern. The nature of on-call care often means that doctors have limited time to make a diagnosis, with little to no access to the patient's medical history. This can lead to a misinterpretation of symptoms, and ultimately, a misdiagnosis. For patients, this could mean receiving unnecessary treatments or, worse still, not receiving the necessary ones, which can exacerbate their condition. Another significant problem is the delay in treatment. On-call issues can lead to a slower response time, which can be detrimental, especially in emergency situations. Every second counts when it comes to severe conditions like heart attacks or strokes. A delay in treatment can not only worsen a patient's condition, but can also be life-threatening. Now let's talk about the psychological stress associated with waiting for care. Imagine being in pain, alone in the middle of the night, waiting anxiously for a doctor to respond to your call. The uncertainty and fear can take a toll on patients' mental health, leading to increased anxiety and stress levels. This psychological stress can further aggravate the physical ailment, creating a vicious cycle that's tough to break. But the impact of on-call problems isn't just immediate. It can also have long-term effects on patients' health and quality of life. Patients who've experienced misdiagnosis or delayed treatment may face ongoing health challenges, such as chronic pain or long-term disability. They may need to undergo additional treatments or surgeries, which can be physically and emotionally draining. This can also lead to financial stress due to increased medical expenses. Furthermore, these experiences can lead to a loss of trust in the healthcare system. Patients may feel hesitant to seek help in the future, fearing another misdiagnosis or delay in treatment. This reluctance to seek care can prevent them from receiving necessary medical attention, which can lead to worsening health over time. Also, the psychological trauma associated with these experiences can lead to long-term mental health issues, such as anxiety or post-traumatic stress disorder. The fear and stress experienced during a medical emergency can have lasting effects, impacting patients' mental well-being for years to come. These are not just isolated incidents. They are indicative of a systemic issue that needs our attention. The on-call problems we've discussed today highlight the need for improvements in our healthcare system. We must strive for a system that provides accurate, timely, and compassionate care to all patients, regardless of the time of day or night. Because at the end of the day, the health and well-being of our patients should always be our top priority. The stories of Jane and John are compelling reminders of the need for improved on-call care. When the sun sets and the hospital corridors are dimly lit, on-call care becomes the beacon of hope for many patients. It's a critical service, yet often overlooked. The challenges Jane and John faced highlight the need for change. They underline the urgency for better training, improved communication, and comprehensive follow-up procedures. Let's take a moment to consider training. We need to ensure that our on-call staff are equipped not just with medical knowledge, but also with the ability to make critical decisions under pressure. On-call work is stressful, and it can be a matter of life and death. Hence, a well-rounded training program that encompasses both the technical and emotional aspects of patient care is paramount. Then there's communication. We live in an age where we can send messages across the world in a split second. Yet within the confines of a hospital, crucial information often gets lost in the shuffle. We need to leverage technology to improve our communication systems. This could mean implementing a robust electronic health record system, or ensuring that medical professionals have immediate access to a patient's health history. It's about ensuring that the right information gets to the right person at the right time. Lastly, let's talk about follow-up procedures. When a patient is discharged from the hospital, their journey to recovery is far from over. The onus is on us to ensure they continue to receive the care they need. This could be as simple as scheduling regular check-ins, or as involved as coordinating with other healthcare providers. It's about ensuring continuity of care, even after the hospital stay. The stories of Jane and John are not isolated incidents. They are symptomatic of a system that needs improvement. By enhancing training, improving communication, and establishing comprehensive follow-up procedures, we can make significant strides in improving on-call care. In the end, the quality of on-call care can make all the difference in a patient's health outcome. It's time we give it the attention it deserves.